Part 3 of Nursing Informatics will start with the ethical use of electronic records. Because after all, ethical use of these resources is really important just because how easily they can be accessed. We, with electronic records, need to make sure we're using passwords and understand that there are audit trails, and always that we're utilizing HIPAA regulations when we're using electronic resources. So passwords need to be complex. The harder it is for hackers to break it, the better. You need to use a combination of letters, numbers, and symbols for maximum protection, and it really is important that you're making the passwords your own and not sharing them with one another. Gone are the days that we could just leave a sticky note with our password for somebody else to use. Let's see, we can't change words. Oh, for passwords, we don't want to make words that are easy to guess or use our name with some number. Our facilities will require us to change our passwords frequently, depending on where we are, and then you can't use the same password within so many tries of each other. Audit trails are used in the healthcare facility and even in education because we need to have software that tracks each person who accesses information. And that's what an audit trail is. So anything a person adds or changes in the record is recorded automatically on the audit trail, and it can be investigated. It's just like in Canvas, I can see every click that you make as a student. It even rates how often you're in a course, right? What you looked at and for how long you looked at it. Audit trails are not only important for electronic healthcare records, but knowing that all the medications you access, how you waste medications, those are also on an audit trail. So just know that everything we do electronically is definitely being tracked and used for information. Let's see, so HIPAA regulations, we want to make sure that not only are we using the the protected health information appropriately, but also that we're not disclosing health information to family inappropriately. We want to limit disclosure to the minimum necessary to accomplish intended purposes. And these rules were extended to the High-Tech Act discussed in your chapter. New rules increase fines to organization for each reported breach of that protected health information. And it gave authority to individual states to monitor compliance with the rules. The rules apply to all forms of communication, electronic, written, and oral. Informatics has allowed for a new model of decision making. Evidence-based practice uses a knowledge base of accumulated best evidence that can change quickly and continuously. To find the current best evidence, you have to be able to locate the evidence, evaluate its quality and relevance to the problem, and then apply the solution. The chapter in textbook talks about utilizing and teaching clients to utilize correct and reliable sources of information. Box 45-4 talks about how to evaluate a health information website. Many of you know this information, but if you struggle to know and you're utilizing the technology appropriately, know that it's hard for family members to get that information. Informatics has enhanced the nursing profession because it's reduced barriers to evidence-based practice. It allows us from the clinical site to click into clinical pharmacology is one example, but also UpToDate, which is a resource of all journal articles. So that facilitates a literature search. It provides online sources for that and then provides databases. In the late 1960s, the first computer systems were implemented in the hospitals. In 1979, the Journal of Nursing Administration featured a monthly column on automation in nursing. It was recognized as a specialty in '92, and then a certification was offered in 1995. Nursing informatics has been redefined in 94, 2001, and 2008 and is a hugely evolving field. According to Thompson, three main shifts catalyzed the evolution of the informatics field, and that was moving from centralized data storage to decentralized data access, moving from paper charts to electronic health records, and moving from relying on memory to continuously using information resources. Some of the roles of the nurse informaticist have evolved to include education and support of health information technology users, system implementations, workflow analysis, playing the role of champion for the electronic medical record, and garnering buy-in by the users, having a liaison between nursing and IT, ensuring that the nursing perspective is represented in organizational health information technology decisions, patient safety, change management, and quality improvement. So this is another exam practice. The nurse sits at the unit computer to begin her shift documentation for her client. She notes the previous user of the computer, the physical therapist, did not log off appropriately. The nurse should report the physical therapist to the unit manager, complete the log off for the physical therapist before beginning her documentation, proceed with her documentation because it will be in a different screen, or call the physical therapist and have her come back and log off. So we're going to reword this question to say, what is an appropriate first action if you find another individual is logged on? And the correct answer is to complete the log off for the physical therapist before beginning documentation. To ensure that documentation is attributed to the correct user, it is important for each user to log off of the electronic medical record. In most institutions, logging off doesn't require a code. It just requires you closing out or using a hotspot kind of button to change it out. We honestly, when electronic healthcare records first came out, the fun thing to do was to send an email by the name of the person who was logged in and then log out. But that was definitely not appropriate. Many lines were crossed in doing that. So meaningful use is defined by the use of certified electronic healthcare technology. Meaningful use is defined as the use of certified electronic healthcare technology in a meaningful manner. In February of 2009, the American Reinvestment and Recovery Act, the Health Information Technology for Economic and Clinical Health Act, or the HITECH Act, were passed. So HITECH proposes the meaningful use of interoperable electronic health records throughout the United States. This operative was led by the Centers for Medicare and Medicaid Services, or CMS. The concept of meaningful use rested on 5 pillars of health outcomes. So we wanted to, 1, improve quality, safety, efficiency, and reduce health disparities. 2, engage patients and families in their health. 3, improve care coordination. 4, improve population and public health. And 5, ensure adequate privacy and security protection for PHI, or personal health information. CMS grants an incentive payment, so money, to eligible professionals or eligible hospitals who can demonstrate that they have engaged in efforts to adopt, implement, or upgrade certified electronic healthcare record technology. So they did a phased approach of this, and in 2011, facilities needed to have data capture and sharing. In 2013, processes need to be completely online. And then in 2015, CMS needed to see improved patient outcomes, improved outcomes overall, based on the electronic healthcare record. Participation in the CMS electronic healthcare incentive program is voluntary. However, if eligible professionals or eligible hospitals fail to join, then there are negative adjustments to their Medicare and Medicaid fees. So there was a 1% reduction, and then it escalated to a 3% reduction by 2017. And so while hospitals weren't told they had to do this, there was incentive, and money talks, right? And then knowing that you're going to be receiving a fee based on not using information, that will affect the implementation of a resource. And that really is how our rural facilities around here were able to get their electronic healthcare record systems. I would say an important thing to remember is that if you'll notice, when you go to smaller acute care facilities in the region, those that are rural access facilities generally have better computerized systems because they didn't have to pay for them. So they got grants to get those resources. And this is what meaningful use looked like, essentially. So the things on the right are some things that your electronic healthcare record could do. And these are important for public health. If you look, the second topic is record smoking status, tracking medications. I know during COVID, when it first hit, there was a company that did statistics, and they were able to say what areas would potentially be hotspots based on these factors. So Medicare, Medicaid users, smoking status, and certain medications. So it's good that we have this, but at the same time, know that we definitely are being watched when we're doing certain things in an electronic healthcare record. But meaningful use is important because essentially it does improve patient outcomes when we can share the information. So, as a patient, would you prefer telehealth or face-to-face consultation? Why? I think this is a great question to ask, especially if we were to ask this question last November before COVID, and now. I feel like many people would have said no thank you previously, and now might be a good option. So it's good to always be evaluating the changes. I mean, this isn't new technology to you guys, but definitely back in the day, it was this newfangled way of doing things. But also ask, if you were an accident victim brought to a rural clinic staffed with only paraprofessionals, CNAs, associate degree nurses, not a surgeon, maybe not even a physician, but rather an NP or a PA, does that change your answer to that telehealth or face-to-face consult? So there definitely is a time and a place for nursing informatics, and we have seen great improvements in it.